The second thing that we're going to do is that we're going to work with specific, and we have many people who are interested, work with specific community-based organizations such as churches. Churches are a big part of many low-income communities, but also the recovery community and a variety of different picking organizations, the senior center. So we're going to take one of those organizations at a time, and we're going to set up a 3-month class with a group, whoever wants to in that organization to participate, and we're going to specifically work on whatever is the most important for that group of people. And as you know, I'm sure, in low-income communities, diabetes is very high, hypertension is very high, there's a lot of asthma, and certainly recovery in some parts of it. So essentially taking one of those as an introductory thing, and then using everything we can over that 3-month period of time to help them help themselves. So it will include acupuncture and herbs, diagnosis for those people who want acupuncture. There's a whole lot of folks who do not want acupuncture, and from my perspective, that's just fine. We can work around a whole lot of ways, but building on the idea that I see is building on the TCM diagnosis, because that's what we have unique to the TCM in the holistic sphere, is that we have a very sophisticated, not always, we don't always know what we're doing, but anyway, that's an aside. We really do know what we're doing, don't we? But at least we know we know spleen chi deficiency when we see it, right? So doing our diagnosis and then building on, like Paul Pitchford, and he is supportive of what we're doing, where we can, for people who have diabetes, we can have the basic syndromes for diabetes at different stages, and we can have information about what's the best food for people to eat when they fall within that category. So using the TCM diagnosis and then using all of these kind of holistic support systems that we can for this 3-month period of time. And so we're going to go from organization to organization doing that kind of 3-month, somewhere in there, I don't know, it may be more or less, on a weekly basis, where we're throwing everything at them. And hopefully then, of course, they can continue coming to the ear clinics after that. There will be ongoing classes that they can come to or whatever. So that's the second thing. The third thing is to have, at least once a week, a community acupuncture model. So as you all heard of, I'm sure, the model that started in Oregon, where it's a group acupuncture where people sit in a lounge chair and can actually receive individual treatment, but in a group setting, right? So it's more treatment and more attention than what they get in the ear clinic, and they'll have to pay a little bit, maybe depending on what they can, but it's another level of care. And then the next one is that they've already agreed that they want to do it with us. The Ravenswood Family Medical Clinic is willing to do integrated medicine one-on-one with people maybe 2 days a week for some period of time, where we will work with the MDs in treating people who come into the clinic. And that's, that's a broadening area, this idea of working in integrated medicine. And then the final thing is to work within 2 years, or at the end of 2 years, by September 2010, I guess it is. Oh my God. That we have a conference in the Bay Area focusing on this subject of using holistic healthcare in communities with low resources, and pulling together people who are working in those communities around healthcare and brainstorm and come up with all the kinds of models and ways that we can increase the use of holistic healthcare in those communities. And, which I think is key, is finding ways to increase the number of representatives who are from those communities to be educated about doing holistic healthcare. So ways that we can get scholarships, ways that more people from the African American and Latino communities, Vietnamese, people who are underrepresented in our holistic healthcare schools. So that is it. Yes.
Yeah, In terms of raising funds, I have some ideas.
You have some ideas? I brought my jar.
Number one, of course, I think you have the proposal that you can apply for federal and state grants. There's a lot of grants that's out there, especially for alternative medicine now. And secondly, you should go to you can go to companies. For instance, pharmaceutical companies selling herb stores. Those stores selling herbs, because those are the people related to you, what you want to do. Number three, what you can do is to have a gala.
A party.
Yes, have fun. Because you have here you have people who want to buy a service or product, and then who people want to sell a service and product. You bring them together, and everybody have some good time.
Okay,
and
so
you get your money.
So vendors, for example, is that what you're
I think in a gala, you should have several functions. Number one function is to have people competing each other, two teams, who
The
raise more
American
money.
way.
American way. Who raise more money? So their face is on the table. Okay. Here, I want to raise more money, so have them compete. Number one. Number two, have a brochure. People selling ads. People will buy ads. One page, $500. Half page, $250. Every store can pay for $250 for a small ad.
Oh, I know that sounds great. I guess, of course,
Okay.
the challenges of the ideas are that.
And then,
Excuse me, go ahead.
yeah,
And what's your name?
Violet.
Violet? Thank you.
Violet. And then third, you can have auctions in the same time, having people eat and buy. So they pay to buy your things that you ask people to donate. So everything you started from zero, but then you will raise a lot of money of this function. But you just have to have a lot of volunteers. But then there's zero money also. So you have all the resources. Bring you a lot of monetary, you will get results.
That's a wonderful idea, and I think as we bring in more people, we've been focusing mainly on services,
You need
but
money.
that
You
we
don't
haven't
have
had the
money,
time.
You're talking about nothing. You
Yeah.
definitely need money, and this way, you have to have a gala once a year.
How about next year?
You're in charge, Violet.
Yes, I know. No, it's wonderful ideas, and I
I've
don't
done this
ordinarily think
before.
that way, so it's wonderful to hear those
No,
ideas, so thank you.
everybody's doing this.
Mhm.
I worked for a museum before. I raised money for 2 years.
Uh-huh.
I raised about $500,000.
Wonderful.
Wow.
Great. Well, your ideas are well appreciated. So anytime you want to brainstorm around that, I would love to hear about it. Thank you. Yeah.
I'm curious, Diane, if there was some like governmental legal things. Did you make Urban Health a nonprofit, or is it? How did that's the part I'm very curious about.
One thing, what we started with is simply incorporating as a California corporation, a nonprofit corporation. And that's pretty easy to do. You don't have to, you really just fill out the forms, and there's the NOLO press book, and you can just do it, and that gives you an entity. So that's a way to start. The problem with that is that if you are raising money, people can't write it off unless you are unless you apply as a nonprofit under the IRS, right? And that's where the status of being a 501c3. That's what that's called. I'm sure most of you have heard that term. It's a classification in the IRS that you are a public foundation, and you have to meet certain criteria. And it's not as easy as it used to be. And I was very fortunate to have, even though I'm a lawyer, it's still hard and it takes time. And of course, I spend most of my time doing this. I didn't mention that my philosophy has been traditionally that I don't raise money for myself, that I support myself by doing other things, and that's primarily teaching. And then I volunteer my time. There are different models for how we go about doing that.